Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers.
Today, drownings and public health. Caroline Lukaszyk, an injury prevention expert at the World Health Organization, talks to Stephanie Desmon about the efforts being made around the world to understand that most drownings are preventable and what's being done to avert them in countries where water is everywhere and flooding is common. Let's listen.
Caroline Lukaszyk, thanks so much for joining me.
Thanks so much, Stephanie. It's great to be here today.
Today, I want to talk to you about drowning and drowning prevention. And I see that you've called it a public health issue. Explain that to me.
So drowning prevention involves a lot of different sectors, a lot of organizations, and a lot of different partners because risk factors for drowning are so incredibly diverse. We look at why people drown, what increases the likelihood of drowning. We can look at maritime transport safety, making sure people can use water-based transport like ferries in a safe situation, and making sure young children have effective adult supervision in community settings, they're not exposed to water, even to the extent of disaster risk reduction and making sure people are safe around floodwaters. So we see that drowning prevention is this extremely multi-sectoral issue. However, it does need a home and it does need a lead agency. And we understand that drowning does profoundly impact on the health and well-being of people. So by framing drowning prevention as a public health issue, we can then sort of give it a home and give it this leadership it deserves and have the health sector be this key coordinating body, this key coordinating actor that brings together all the other partners we require for a really comprehensive, holistic approach to the issue.
So paint a picture for us. What is drowning? What does it look like across the world in terms of its impact?
So I think I might have flagged a couple of circumstances in my previous comments, but I think a common misconception people might have is that drowning occurs among children in swimming pools in high-income countries, and that's sort of the extent of the issue. And of course it does, and that's extremely tragic. But when we look at global drowning burden, we see that over 90% of drowning deaths occur in low and middle-income countries. And in these sort of low resource settings, your risk factors for drowning and the circumstances in which it occurs are very, very different. The WHO focuses on drowning prevention, looking at occupational safety, so safety of people such as fisher folks who work on water in all different types of climates, in different types of social security settings as well. We also look at drowning prevention, again, like I mentioned earlier, for communities that are exposed to floods and disasters, making sure people are able to safeguard their homes and their families effectively against water in this circumstance. There are so many different complicated risk factors for drowning that really do go beyond that sort of high income idea that we might have about it. So again, it's really important to sort of take a step back and understand this, how it looks like in communities around the world.
Mm-hmm. We talk about that many of these deaths are preventable. It seems as though it's a whole different landscape when you look at these developing countries.
Absolutely. And so the interventions for drowning prevention, what the World Health Organization have done is developed a suite of these interventions, recommendations for drowning prevention that we've made sure are adaptable, scalable, and cost-effective for all different types of settings. How these interventions are implemented varies extremely differently between countries. I think one really nice, it's a relatively simple example, but I think an important one is teaching swimming and water safety skills to children, school-aged children. We know this is an effective drowning prevention measure. In a high-income setting, this might look very much around organised swimming lessons in swimming pool facilities, that the water quality is monitored and maintained and there's great infrastructure around it. But if you're thinking about a rural community in Bangladesh or in India, those facilities are just not available. And so we work with partners all around the world to better tailor our guidance to make sure it can be used everywhere. And in places such as India and Bangladesh, we've seen this excellent uptake of community-based swim instructors actually building their own water safety training facilities in rural ponds and rivers. There's, of course, a very strict safety protocol that's been developed around this, and they actually managed to build and submerge these bamboo platforms and other type of infrastructure beneath the water to make it a safe space for children to be able to learn how to swim. There's a flat barrier on the bottom. There's clear sort of scaffolding on the sides. And so again, if you think about these recommendations of WHO, they might seem high-income focused, but there really is this opportunity to deliver them in all different types of settings with all different types of resource constraints too.
That's really interesting. We know about teaching water safety. Are there other things we can do to prevent drownings in these settings?
Yes, absolutely. We know that the vast majority of drowning deaths really heartbreakingly occurs among children. So you have these two pockets, these two age groups. The first is the 1 to 4-year-olds. And this is toddlers. These are children who are starting to mobilize. They're starting to explore their communities. They may not understand the hazards associated with water. They likely don't understand the hazards associated with water. And so we see a really large proportion of drowning deaths occurring among these really young children. And then we have the school-age children, and that's more around not having the proper swimming and water safety skills to be able to interact safely with water. So we talked about swimming and water safety education, but for these really young kids, it's mainly around making sure there's effective adult supervision. And again, in a high-income setting, you might imagine this as a daycare service or a creche, something quite structured, well-organized in the community. But again, we've had partners that are able to take this model and replicate it in a lower resource setting. And again, I speak to partners in Vietnam and Bangladesh. We've taken this sort of community daycare model and trained mothers in local communities to bring children together in their houses. They give them support with financial support, government or other donors, to basically bring kids together between the hours of 9 a.m. and 1 p.m. when other family members are very busy with household chores or with work, and keep an eye and supervise these children over that time. So that's another really effective drowning prevention intervention. It's been shown to significantly reduce drowning deaths in communities in Bangladesh too.
How do you talk to parents about prevention? I mean, I imagine that anytime there's a drowning death, there's a lot of guilt, right? And that, is there a way to sort of, on the front end, frame things differently to help people to prevent this?
Yeah, absolutely. It's definitely taking a strengths-based approach to the issue. And I think with the issue of drowning prevention, what makes it maybe slightly unique is that there are so many co-benefits of these interventions we're talking about for drowning prevention. So we're talking about effective child supervision, for example, through like a daycare model or through a community supervision model. We can talk about all these great benefits of socialization, education, and even taking it up to such as vaccination programs or nutrition, early childhood development. When we're talking about swimming and water safety skills, we're talking about physical activity and healthy lifestyle and healthy choices. So when we do come to parents and talk about drowning prevention, it is such a heavy and serious issue, and it's so tragic. But the prevention side of things is also extremely positive. It's not necessarily so impossible to implement across different settings, and yet there are so many great other benefits it can have for health and well-being of children. So this is the sort of approach we take. It's very much strengths-based. And very much the underlying message that drowning is preventable. It's a devastating event. And there's a lot of misconceptions that it's an accident, that it occurs because it occurs and there's nothing that can be done. It's just something that happens and it's very unfortunate. The messaging we have is, again, it's definitely preventable and there's lots of great co-benefits for drowning prevention work.
That's a great message that I have heard from you, because, I think we don't think necessarily that drowning is preventable in, say, countries where they have monsoons, they have a lot of bodies of water. Understanding that it can be preventable, I think, is probably really empowering for people.
Absolutely. I think it's definitely empowering. I think it also creates a bit of ownership over the issue as well. I think once you understand that you can do really simple things to prevent it, there is a lot more community mobilization and ownership to actually implement these things, which is really helpful for the community-based efforts.
So do we fully have a picture of the problem? Are we underestimating deaths? Like, how do we feel about sort of what we know?
We are definitely underestimating the true burden of the issue. This is primarily because drowning deaths don't occur in hospital beds. This is if you have a medical condition where it's quite, you see patients, you monitor patients, you can give, for example, treatments. There's a way to document people that pass away. It's a much more linear sort of way to monitor that burden or that impact. And with drowning, we see particularly in sort of maybe low resource communities or communities that are very far away and remote, it's difficult to find a medical practitioner a lot of times to issue a death certificate or to provide potential treatment if it's been a very severe non-fatal drowning incident. And because of this, we're missing a lot of this data that is collected for lots of other health issues. To sort of address this and to find a creative solution around this is we're looking at other data sources that are routinely captured at that community level. We're working with local authorities, whether they be from law enforcement, whether they're search and rescue, whether they're religious organisations, whether they're the education sector, people that know their local communities, they know the families living there who make documentation around health and wellbeing outcomes. It's really about working with these local community groups to better understand not just the burden and the numbers of people that are drowning, but also the situation it occurs in, the circumstances, and what can be done to change these circumstances so that more deaths don't occur down the track.
So in your mind, what's sort of the ideal scenario? What can people, if you had, more funding, if you had more resources, what would we do to address this problem more fully?
So the evidence base for what works to prevent drowning is quite strong. So we have that evidence of what works. Now we need to work out how we can get that evidence into communities and how we can actually get it implemented uniformly and equitably around the world, including all these communities you were saying that have ponds and streams running between houses. That's always, I think, in public health, a really big challenge and a big barrier. How do you get best practice to be that community level? And so if we had unlimited resources, I would just focus them on more co-development. I would focus on working with more communities, more diverse communities in different parts of the world who perhaps we haven't had the opportunity to speak about this issue before, to really understand the lived reality of drowning risk and what can be done realistically and feasibly to address it. And again, the beauty of this is there is so much knowledge sharing that can take place between countries, between communities. So another really important thing to do is to establish some sort of knowledge sharing mechanisms that you can connect people in different similar settings but in different places to sort of share what they've known. And this is definitely something we're trying to do, but it's definitely something that's quite resource intensive. But I think this is where the solutions lie. It's the communities that and their lived reality.
I was going to ask about the communities. I do a lot of work with people who work with communities to come up with solutions. Talk to me a little bit about how valuable the communities are. I mean, we may think we have these great ideas, but you learn the most, right? Coming straight to the folks who are living it.
I completely agree. And this might be a little bit of a step back, but it's definitely one of the best parts of my job. And this is why no 2 days of my job are ever the same. You're always learning something new, depending on who you're working with in a different community setting, a different place. From an external point, from a sort of international or point of view, you can look at all the data sources available. You can look at all of the different sort of routine data collection taking place by different sectors. But to properly understand the context and to properly understand risks, you really need to have someone that you need to collaborate and work in partnership with people who have been in this situation for a long time. It's absolutely critical. And I think that's really key to these recommendations, these global recommendations we make, to making sure they're usable and implementable. And we're very open with saying that we're constantly evolving and adapting our recommendations because we're constantly learning more from the communities that are actually trying to implement them.
Carolyn Lukaszyk, thank you so much for joining me.
Of course, it's an absolute pleasure. Thank you for the opportunity, Stephanie. It's been a great chat to you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.